Trump, physical therapist.
And I'm Brad Heineck, physical
And
therapist.
together we are the most famous physical therapists on the internet,
In our opinion,
in our opinion. We're talking about something Brad wants to talk about today. It's always all about Brad.
that's about me, but this is important, Bob.
Right.
This is something, there's gonna be a lot of people who have a total knee replacement, and we've got a number of videos that are helpful. People are even giving us good feedback on the help that these videos do for when you're at home. What do you do for your knee to get it better, faster?
Right.
Okay, it's not very comfortable, total knee is painful.
It is painful.
That first couple weeks is not real fun, but this is something that's gonna help you control the pain as well as get range of motion, and to get range of motion to get the knee straighter. You know, as when you go to see your therapist, they're gonna talk about range of motion and bending your knee to get it to bend better, but also you want full extension.
If you don't get full extension, you're gonna limp.
Exactly.
So it's really very noticeable if you don't have your knee completely straight.
So this is something you want to pay close attention to. It's a simple technique. You're going to use it with your ice pack and to get a stretch on your knee. So Bob, what I'm going to need is if you can get up and just kind of,
Get away?
I'm just kidding, Bob. Hey, hang on closer, I might need you.
All right.
But this is it. You're going to sit in your chair. You can have an ice pack next, there you go. Then you're going to take your cold pack. You'll have your list of exercises from the hospital or from the therapist, and after you do your exercises, the typical thing is to put a cold pack on your knee for 15 to 20 minutes, okay? So that is an ideal time to get your knee to, here, let me use this leg, to stretch out, okay? You'll get a chair. This might be a little high. Usually after surgery, you're gonna have a little bit shorter chair, or this one could be a little bit higher, but some people can do this. If I put my knee on here like this, and I wrap my cold pack around here, that's a good way to cool it down, help the swelling. It feels good, very comfortable, but it's not gonna do anything to help stretch it out straight. So when you first do this, you're gonna move the chair out farther away from you, and it's a little easier with another person to move that chair out. And now gravity is gonna pull on this cold pack, and my knee is gonna straighten this way. It's gonna be a little uncomfortable. And this is the part where you kind of have to, you know, bite the bullet a little bit. Uncomfortable, but you still want that stretch, and I'd hold it there for about 2 to 3 minutes. When it gets to the point where it's like, this is really no fun anymore, then you pull the chair in a little bit. It takes stress off the knee, not so much pressure on it, feels better. And when I do this with my patients, they'll be sitting there for 2 or 3 minutes and they're saying, Brad, this is very fun. And I'll pull the chair in, big smile comes over their face, it relaxes the knee, the stretch is already done, the work part is done, and now you get to relax it and just bring it in underneath the calf will do it. And then you finish the rest of your icing for the next 15 minutes or so without any pain.
And what I'll have people do, Brad, which is pretty much almost the same thing, is I'll have them, when they're stretching for a while, as an alternative, is to just go ahead and bend the knee for a while, like this, just to give it a little break, and then go back into it a little bit.
Yeah,
So,
you can do a lot, oscillation, would you call that,
Right.
Bob?
oscillation,
Sure.
or contract relax, I guess you could call it.
Mhm.
So, either way, we want to get that baby straight.
You bet. Total knees, you can make them much easier at home. Just look at our videos. We've got a lot of good hints on what to do with them.
Well,